Welcome to Is It True? And welcome again to my scientific co-host, Eva Milinkovic.
Hello, Gerrit. Thanks for having me again in this interesting format.
Exactly. In this fast-paced program, we try to debunk and put some science behind some of the big questions that circulate in our community. Now, Eva, let's dive right into the first topic. What is the question and who is our expert?
We have Professor Tali Chackartchi, and she is trying to answer, is it true that guided implant placement in edentulous patients is a reliable procedure?
Well, it's going to be extremely predictable, much more than freehand implant installation. However, we must keep attention for several things. And I would like to share with you two very important clinical tips to make your work much more predictable. Well, you know, whenever we are using digital tools, it's quite a challenge to make sure that we are accurately positioning the information from the patient's mouth to the digital platform and then back again. In case of guided surgery, we need to make sure that we create a digital file that is reliable with all the information of the patient in proper coordinates, one on top of the other. Then, when we go back to the patient's mouth, we need to make sure that the guide sits in proper position according to the tissues of the patient. Therefore, whenever we have teeth, we are on safe grounds because the teeth are going to be rigid components that are going to help us calibrate all the information on the screen of the computer, and then back again when we go back to the patient's mouth with the guide. However, when we are dealing with full edentulous cases, then we are kind of lost in the desert. We don't have really any rigid components, of course, unless we are going to use mini implants, but then the situation is different. We don't really know where to put the scanning of the patient in relation to the CT scan of the patient. However, if we are going to register the information a little bit differently, if we are going to send the patient to a CT scan in a full retraction protocol, meaning that we are going to have air around the soft tissues of the patient, then we are going to have the whole outline of the soft tissue that help us calibrate later on and superimpose the cast of the patient or the scanning of the patient, the model of the patient's mouth. And it will help us create a more reliable digital tool. Now, the second tip is related to the guide position. Whenever we want to go back to the patient's mouth with the guide, we don't really have any anchoring points since we don't have teeth, and in many cases we don't have temporary implants. However, we need to make sure that the guide sits in the proper relations with the soft tissue before we even inject anesthesia, just to make sure that we are in proper calibration, in proper position. This is going to be probably the most important stage in order to make sure that the outcome is going to be reliable. So yes, of course, guided surgery for full edentulous cases is extremely reliable.
Thank you, Tali, for telling us this is in fact true. But however, right? It's kind of tricky. Eva, what does this answer mean for the clinical practice when we move forward with the edentulous patients?
I think Tali really helped us understand better how we can stay reliable because, as Tali explained, guided implant surgery is a huge advancement in implant dentistry, but it doesn't mean that it is easy. We need some data and we also need how to process that data. So we need a real knowledge behind, and Tali is one of the master scientists and clinicians in the field. So with providing us with these two tips, how to position our patient, how to do the data acquisition in, let's say, more accurate and more repeatable way, and also how to check our guide positioning, because it is crucial to have guide seated in place for static guided surgery in order to have our edentulous patients treated in a reliable way. So guided implant treatment is great. We need to have know-how, we need to have right tools, and we need to have the right execution of the treatment.
Exactly. Do you think How do you know when you're ready for a fully edentulous patient? I can imagine this is not something for a starter.
This is definitely advanced to complex procedure in any step, even if we are not talking about guided. But for guided implant placement of edentulous patients, you really need a residency program, a training, a literature backup, and then you can dive into this really complex procedure. It is much better to do it in a guided way, but you need to be prepared for that.
Exactly. Well, thank you very much, Eva, for building on that topic. Thank you, Tali, and thank you for watching and educating yourself based on science.